Welcome, everybody. My name is Larry Hofheimer, and I am the founder and chairman of the Macular Degeneration Association. I welcome all of you, mostly who are patients and caregivers, to a series of webinars that specialize in giving information to people about various eye conditions with a special focus on macular degeneration. Okay, we have two speakers today. I'm going to now introduce our first speaker. Her name is Megan Blenker. She is an ocular disease residency trained optometrist who practiced in Nashville for 9 years. Since then, she joined industry and is now works for Nona Vision and serves as their Director of Clinical Affairs and Professional Relations. We're going to have a slide presentation of hers, and she will be available to answer questions after that's complete. So it's now my pleasure to introduce the presentation by Dr. Blenker.
Thank you so much for the introduction. No-Tel Vision is proud to partner with the Macular Degeneration Association, and I appreciate the opportunity to speak to you all today. It is such a privilege. To reiterate some of the important points made in the presentation, I'd like to further discuss understanding the importance of early detection of wet AMD and how you can play a role in protecting your vision. 4C Home is FDA cleared and Medicare covered. It's prescribed by your eye care professional when you have the appropriate level of vision and appropriate stage of age-related macular degeneration. It's a form of personalized medicine with the 4C Home device used at home in between your regular eye exams, and it detects metamorphopsia or visual distortions in AMD. AMD is the leading cause of severe central vision loss in people over the age of 50 years in the United States. I'm going to share with you the information you need to get informed and take charge of your vision. AMD is a chronic, meaning it doesn't resolve or go away, progressive, meaning it tends to worsen over time, type of condition. And there are two types of AMD, dry and wet. Dry AMD is the slower changing, earlier form of the disease that puts you at risk for developing the wet form of AMD. And wet AMD is the sudden change or advanced form of the disease. AMD affects an area of the retina called the macula, which is responsible for detailed central vision used for activities like reading, driving, and seeing faces clearly. In dry AMD, changes occur in the cells of the macula, and drusen, or deposits, these yellow spots that you see here on the right side of the screen in the picture, build up in this area. And these changes may induce blurry vision, such as difficulty seeing sharp details both up close and far away. Dry AMD is the slow form of the disease, with changes you may not notice over time. Most importantly, dry AMD puts you at an increased risk of progressing to wet AMD. Over time, the size and number of these drusen or deposits can increase, which increases your risk of developing the more sight-threatening form, wet AMD. Again, dry AMD can suddenly change to wet AMD without any kind of advance notice. If you convert to wet AMD, abnormal blood vessels grow under and into the retina in the macula, as you'll see here on the right side of the screen. These blood vessels can leak fluid, and they can sometimes bleed without any type of warning. You may not notice these changes until significant vision loss has occurred. If you convert to wet AMD, this significant vision loss can be rapid and severe. Symptoms of wet AMD include distortion, where straight lines look wavy. You can have dark spots in your vision, or just generalized blurry vision, as you see here on the screen. Unlike dry AMD, there are effective treatments for wet AMD, but these treatments are most effective when administered early on before symptoms are noticed and before vision loss has occurred. These treatments can halt or slow the progression of wet AMD, but they cannot restore vision that's already been lost. Once the wet disease starts, it will continue to advance until you receive treatment. Irreversible damage can occur within days to weeks and before symptoms are even noticed. But how early is early detection? Once symptoms of visual impairment are noticed, those wavy lines or dark spots appear in your vision, then the vision loss may have already occurred. The earlier you catch wet AMD, the better chance you have of preserving your vision, your independence, and the ability to go about your daily life participating in activities you enjoy. So, wet AMD treatments are most effective when the disease is caught early. 4C Home is an early warning system for your eyes. You use this device at home in between your regular eye exams. It helps people with dry AMD detect wet AMD before you even notice that visual changes have occurred. But how does it work? Well, you take a simple daily test that checks for tiny changes in your vision. The test takes just a few minutes per eye per day. The data from each test is then sent to your eye doctor as well as the No-Tal Vision Diagnostic Clinic, the medical provider of 4C Home. If a change in test scores is detected, the diagnostic clinic alerts your doctor. Your doctor's office will then contact you directly to schedule a follow-up visit. The Amsler grid, as you see here on the left side of the screen, was developed in the 1940s and has for a long time been recommended as a simple and accessible tool that you can use from home to monitor the changes in your vision. However, by the time you notice vision distortions on this Amsler grid, significant vision loss may have already occurred. Fortunately, new technology such as the 4C Home AMD monitoring program has been developed so you can detect tiny changes before symptoms are noticed, and the system reports them to your doctor so you can receive immediate examination and treatment if necessary. Testing with 4C Home is easy. You turn the device on and look into the viewfinder to begin testing. Then a bump will briefly appear and disappear, as you can see here in the center green circle on the screen. You'll use the mouse provided to click where the bump appeared and then return to this center dot. Data from each test is then sent to the No-Tal Vision Diagnostic Clinic for evaluation and provided to your eye doctor as well. Regular at-home monitoring is like brushing your teeth. It's just a good, healthy habit you do every day to help preserve your vision. 4C Home allows you to take a proactive approach to protect your vision. A clinical partner will be with you every step of the way. After the No-Tal Vision Diagnostic Clinic receives a referral from your doctor, we'll answer any questions, verify coverage, and ship your device. Once you receive the device, the No-Tal Vision Diagnostic Clinic will walk you through setup and training. You and your doctor will continue to receive feedback from the No-Tal Vision Diagnostic Clinic. Our team will be sure to verify your insurance benefits and discuss with you prior to your acceptance of the device and prior to getting started with the program. There are low out-of-pocket costs for Medicare patients. So patients with Medicare and a secondary supplement plan could have out-of-pocket costs as low as $0 per month. Patients with Medicare and no secondary supplement plan will pay $15.06 per month once their yearly Medicare fee-for-service Part B deductible is met. Again, 4C Home is FDA cleared and Medicare covered. Your doctor will send our No-Tal Vision Diagnostic Clinic the order for you to begin the 4C Home AMD monitoring program. And appropriate candidates have a particular stage of dry AMD and a particular level of vision, which will be determined by your doctor. You'll continue to test regularly at home. If a change takes place, your doctor will be alerted and have you come in for an examination. In summary, the No-Tal Vision Diagnostic Clinic works with your doctor to remotely monitor your dry AMD, helping you retain functional vision throughout your AMD journey. I'm happy to answer any questions you might have, and thank you so much. Here's my contact information for your reference. I would love to hear from you.
One of the most frequently asked questions that I will get is about utilizing 4C Home if you have arthritis or if your hands shake, or if perhaps you have a tremor and your head shakes when you're trying to utilize the technology. And the good news is there's no obligation with utilizing our program, meaning that if your doctor thinks by examining your eyes that you're at the appropriate stage of AMD and you have the appropriate level of vision, and they refer you to our program, that once you receive the device and try to use it, if it doesn't work out, if you don't happen to be compatible, then no worries. We will take the device back. We will make sure that all of the shipping costs and the logistics are handled from our team, and we'll make sure that we get that device back from you. So it's worth a try. And most patients do find that it is very user friendly and that it is compatible in most situations. The next question is, how long does it take to receive the machine? How long does it take to get to using the device? Excellent question. So we want to get the device to you as soon as possible. There are several steps that happen before the device gets to you to make sure that you are comfortable and have all the information you need before getting started with the monitoring program. And what I mean by that is once we receive the referral from your doctor, then we have a patient financial services team that will review your insurance information and discuss with you what, if anything, that you might pay out of pocket that your insurance portion doesn't cover. If you would like to move ahead with the program, then we'll of course confirm your Wi-Fi or cellular connection, how you would connect to the online service to be able to submit your testing to us after you use the technology. And then once we ship the device to you, our same team members who are ophthalmic professionals, who many have worked in optometric or ophthalmology practices, they'll be on the phone with you to make sure that they help you with setup, getting everything going, run through the first series of tests with you, and make sure you're comfortable with the testing. So we like to say that we get the device out to you within days of confirming all of that information for you, but we'll make sure to discuss with you before we just ship it to your home. The next question is, my mom has been diagnosed with dry AMD. Should she get this program? Excellent question. If she falls within the category of the intermediate or the middle stage of age-related macular degeneration of the dry form, and her visual acuity is 20/60 or better, so if she's examined and her vision on the eye chart is appropriate for what's indicated, then absolutely she'd be a great candidate. The next question is, do you know anything about Lumathera Light for dry macular degeneration? Well, we have an expert coming on the line soon, so I will let Dr. Rathan take that question. Excellent question. I'm sure he's up to date on that information. In regards to 4C Home, do you have a list of doctors that might be in my area that I can see? We do have a physician finder feature on our website. It's 4chome.com. So you can go there and check out doctors in your area that are referring patients to our service. Does this exist in Greece or in Europe? Right now, the 4C Home is approved and covered only in the United States. Next comment is, my doctor didn't know about this program. I mentioned it to him and he said he was going to contact you. Excellent. Well, we do have on our website, again, there's a link where you can click on there and you can send us an email if you have a question. My contact information is available to you. I know that my partners here, the Macular Degeneration Association, have that, and you're welcome to reach out to me personally as well. But we would love to hear from your doctor and from you. Does this program tell you how many drusen you have? So great question. Those drusen are those deposits, those yellow spots in the retina and the macula there. And so it doesn't really give a number or an outline in the physical sense of looking at it and seeing how many you have. What it does do is it shows us the distortion that those deposits and that disruption in your retina create. So that's where that metamorphopsia or the distortion detector that 4C Home uses comes into play. Does this program still work if you don't do it every day? So we do encourage patients to test every single day. We have a bare minimum, of course, of what is authorized and what would work best for the artificial intelligence to be able to determine if there's been a change. So I like to say that the more you test, the more chance you give the device to pick up a change. And I think it's just easier to be able to get into a daily routine or a habit with testing every day. So just like you brush your teeth, if you're a coffee drinker, you can do it while your coffee's brewing, but just some way to work it into your daily routine so that you remember to monitor with it every day. Are there false positives? In short, yes. With any test, there are false positives and false negatives. With false positives, it's a way that the system is designed, usually by intent, to be more sensitive. So we want to make sure we don't miss any disease. As far as a false positive, a lot of times what that means when the patients come in who've had an alert, the doctor takes a look at their eyes and there has not been a conversion to wet AMD, they'll ask them to continue testing. We have heard from our referring physicians that there's maybe a shift in the drusen because this is a dynamic process and it's a long, slow process. There's also cases where there are other diseases that have been picked up that the device is not indicated for, but because it's happening right there in that very important center part of your vision and it's causing distortion, then the 4C home, which is very sensitive, will trigger an alert that something has changed. That's why it's good when you get an alert to go and see your doctor, the expert who is examining your eyes, to determine best next steps. What if the machine says there's a change, but my doctor doesn't see anything? Some of those reasons that I just mentioned, a lot can happen in that central portion of your vision. So that is one thing or one more reason that it's important that you have your eye doctor examine. The next question is, my doctor noticed a change in my vision before the machine. Is this common? Excellent question. So the idea behind 4C Home is that it's not replacing anything that's happening already with your care. So if you're going in to see your eye doctor regularly, if you've been advised to take any kind of supplements or nutraceuticals, if you've been advised to call the doctor and come in if you've had any change in symptoms or change in vision, these are all considered the standard of care or the protocol, the recommendations by your doctor. So you should follow those. 4C Home is just another tool in the toolbox to give you a chance to be able to detect that change earlier. If you do not have insurance, how much would this program cost? That's something that our patient financial services team would be able to review in detail because every plan is different. I don't want to give a blanket statement, but to give you an idea of our national average of the copayment amount that patients will pay if Medicare covers, but your secondary doesn't pick it up, it's about $15 per month for the recurring payment model. But our team would go over all of that with you before accepting the program and shipping the device to you. And then the last one says, I wanted to let you know that I think this program is wonderful and everyone should be using it. It saved my vision. Thank you. Thank you for sharing. I always love hearing these stories and it's very heartwarming. This is exactly why we do what we do. And we want to partner with your physicians to give you the best chance for your vision. So. Last question. Oh, hi, Larry. There was one last question about comparison with the Amsler grid. I know I touched on that in the presentation. As far as that's concerned, the Amsler grid's been around for a long time, and it is a piece of paper compared to this very sensitive advanced technology. As far as the Amsler grid, it is challenging as well for people to keep up with whether or not they have their eye properly covered and at what distance to hold the test and do they remember to use it. So since we have an entire team of folks plus the technology to be able to help you with this, it's a much more sensitive and specific type of test to help you out.
Thank you, Dr. Bunker.
Thank you for having me.
I'd like to move on and introduce our next speaker, who's going to begin by presenting a slideshow or a video, and he will come on later to speak and answer questions. His name is Rajev Rathan. He is a medical board member of the Macular Degeneration Association, and he is board certified ophthalmologist. He is a native of Orange County, California, went to Stanford University, received his BS in biology there, returned to California a year later and did his internship at Washington University in St. Louis. Dr. Rathan has been a fantastic speaker for us, and I'd like you to see his video first, and then he will present with Q&A.
We have Mr. Gamble here, who has graciously agreed to be interviewed regarding his experience with macular degeneration and receiving treatments with intravitreal injections. Mr. Gamble, thank you again for your time, and thank you for sharing your experience. We appreciate your input and participating and helping folks to understand what it's like to have macular degeneration and get treatment for macular degeneration with injections in the eye. So let me ask you, what was your first thought when you were first told that you were going to need injections in your eyes for macular degeneration?
Well, I would be lying if I said that I didn't freak me out because, you know, I'm very sensitive in the eyes anyway, but I've been going to ophthalmologists every year, and I've also been going to OC Retina for quite a while, and used to having people dilate my eyes and all that. But that's so different, and having pictures taken and that, but it's so different of having an injection in my eye. I have a problem, and it still freaks me out, is when you check for glaucoma to touch my eye with that. And I thought, what in the world happens when they stick a needle in your eye? But I trust you, doctor, and I've trusted all of your medical assistants, and I've met about 6 or 7 of them. And so I trusted them. And so it calms me down a lot to know that you guys care for me.
So I'll just say that you're not alone in having those thoughts and fears when someone tells you that you're going to get an injection in the eye. Obviously, that at first sounds like a scary prospect. Certainly, a lot of people are sensitive with the eyes to begin with, and then having a needle inserted into the eye directly often catches folks off guard. So that is a very common reaction and common viewpoint on initially being told about needing to get an injection. So now, the first time you received an injection, do you remember sort of your feeling or your thoughts and what it was like? And can you kind of give us a description from your perspective of what it was like to get the injection the first time?
Well, it started out very similar to the rest, where they put the drops in to dilate my eyes, and then they started a new procedure where they would put a smear or something on my eyeball to start deadening it. The first one seemed more liquidy, and then it got a little thicker as it went through, and then they took a Q-tip and held it on my eye. I knew at that point it was going to be different, but my eyes become deadened at that point. And so that when I went into the other room, they still had a couple of procedures that they used to deaden your eye. And from there on, it went very smoothly.
And what Mr. Gamble is describing is and there are different ways of numbing up the eye, but some common ways of numbing up the eye prior to injection are using eye drops and gels and Q-tips to help to anesthetize or numb the surface of the eye, so that when the injection itself is given, there's really no pain involved. Rather, you might feel a little pressure sensation, but generally the injection itself is not painful. And Mr. Gamble, can you attest to that after your eye was numbed up and you had the injection, you were surprised that you didn't feel as much as you might have thought you would from getting injected?
No, it was just a little pinprick, and then I see the injected, and I see what I call a jellyfish. It looks like a jellyfish shows up in my eye, but it was painless, basically.
And I think that's a common reaction. Often I give folks their first injection, and their first reaction is, that was it? You already did it? As if to say, oh, I didn't even know you had already given the injection. And what Mr. Gamble described is that you can actually sometimes see the liquid, which is the fluid of the medicine as given as an injection as it enters into the eye. And sometimes it looks like a jellyfish, or some people say like an amoeba, little cloud. And that usually clears up after a few minutes. But you can actually see the fluid from the injection going into the eye. And that's really the only evidence or sensation that people know that they've actually gotten the injection is that they can actually see the fluid. But outside of that, they may feel just a tiny little pressure, or as you said, like a little pinch. And I generally will warn people by saying little pinch, to tell them ahead of time that I'm about to give the injection, just so they know it's coming. But to say that it's actually going to be minimal amount of sensation that you feel. So now you've been getting injections for several years, and you're kind of used to it. You're a veteran with the injection process, and everyone comes up with sort of routines, and a lot of folks have some anxiety over getting the injection the night before. So is there anything you do to prepare ahead of time before you get an injection?
Not really. I feel very comfortable coming into the office and seeing the people that I've met before and what they've done. And I get sort of in a routine, as long as that routine happens, and the deadening of my eye, and then looking down and left or right or whichever eye. And I get used to that, and it's not a big problem. So I just relax and go with the flow.
And then after the injection, what can you expect, and what are some of the things that you experience or look out for after you get an injection?
Once I get an injection, and my wife usually drives me home, is that within an hour, I normally get a very horrible headache. And it stays with me for quite a while. When I first started the injections, they were pretty severe, but this last one only lasted about, 30 minutes. And then it just sort of immediately just poof, disappears. So hopefully from here on out, that's what will happen. So, but I've always expected to have a headache. And so what I normally do is get an audio book, and I listen to an audio book, and everything comes out okay.
So I think what Mr. Gamble is experiencing sometimes with an injection, the pressure in the eye goes up a little bit, and that can be translated or felt as a headache, which generally lasts for anywhere from 30 minutes to an hour. Not to say that everyone experiences that, but some people do certainly experience that. And sometimes the eye can feel a little irritated afterwards, like a dry sensation or a foreign body sensation, just from the preparation process. So we generally tell folks to use lubricating drops afterwards if it does start to feel irritated. And then of course it is an injection in the eye, so we caution folks to keep the area clean, not to touch the eye with dirty hands, and not to let dirty water run into the eye, just to prevent the possibility of getting an infection in the eye. So that's a very typical after injection experience. So if Mr. Gamble, if somebody were to come to you and say, hey, my doctor told me I need to get injections in my eye, how would you prepare them, or what would you say to them to help them get through that? How would you give them your take on it to say, hey, this isn't something you need to be too worried about?
I said, first of all, is you have to know and have comfort in your doctor and their assistants that they are working for your benefit. And if you don't have that, you're probably in the wrong place to start with. But if you have that, go with it, do what they say, and everything will come out okay.
I like it, the go with the flow kind of mentality. Now, looking at sort of your overall quality of life and life experience, because obviously having to come in sometimes twice a month for injections, because you get it in one in each eye, it can put a toll on your schedule and your quality of life. And for many people, often people are retired, but some people are still working, and you need to come in and make time for appointments. What can you say about the overall effect of having to get these treatments on your quality of your life and your ability to do the things that you normally do and like to do?
Well, as being retired, I pretty well have a pretty flexible schedule that I can work around. that's not a problem. I would love to be able to go in and get both injections in both eyes at one time rather than spacing them out at a week and a week from that. But other than that, it's not affecting my ability or my life, other than it is having an effect on my ability to drive, because this last time I had to take a form in from the DMV that you guys have checked my eyes and all that, and they've only renewed my license for 2 years. And if it degenerates further, if my left eye degenerates further, then I probably will have to quit driving. So that would have a bigger effect on my life than anything.
Well, we can see that you like to travel. It seems like you're in an exotic
Yes.
place right now, but you're still able to do things like travel and, you know, and obviously times are different right now, but outside of the pandemic concern, you've been able to do sort of all the things that you generally enjoy and like to do in your life.
Yes, it really is. Carol and I have traveled to over 70 countries, and we've been to all 50 states. And so we do a lot of traveling, and we still have a lot of plans to go. And it is not affecting that at all. Even if my left eye becomes worse, it is still not going to affect our ability to travel, because she is a good set of my eyes. We've been married almost 55 years. So it will continue, and it doesn't affect our lifestyle.
Good. Well, good for you. Now you already mentioned that you have your wife Carol drives you to your appointments when you get the injections.
Yes.
And that's not uncommon to have somebody to drive you to the appointments. I will say that there are some folks who feel very comfortable driving after an injection. So it's not to say that you're unable to drive. It's just more of a comfort level after getting the injection.
The big deal is not the injection so much as usually have my eyes dilated, because you also look at them and take photos and that. So it's more the dilation than the injection.
Sure. Yeah. Yeah. So if it's just an injection, then you may still actually be able to.
I could drive. That's not a problem.
Sure. Okay.
All right, we're gonna give an intravitreal injection. This is for macular degeneration, and our patient here has kindly volunteered to allow us to videotape the injection process. So we're working on the left eye today. I'm gonna have you look down to your right here for me. So we've already prepared the eye with anesthetic so that the eye is completely numb. Okay, and hold real still. Little pinch. And all set. You okay?
Yep.
Good afternoon and good evening. Thank you all for your attention. So now you've got a sort of perspective on the patient experience in macular degeneration and what it's like to have the diagnosis and have to undergo treatment, and to see what it's like to get the treatment for macular degeneration. So now I'm just going to talk a little bit about some of the other aspects of macular degeneration as a disease. So, when we talk about macular degeneration again, and I'll just kind of repeat a few things. Again, this is a chronic disease, degenerative process that we really don't completely understand entirely the underlying process here, but generally affects folks as we get older and affects central vision. has a significant impact on the society, especially in more developed countries, and is the most common cause of irreversible vision loss in Americans over the age of 60. To some degree, 15 million Americans are affected by this disease. And if we think about it, every 3 minutes, there is a new diagnosis of macular degeneration. So you can see how common it is and how significant that can be in terms of the burden on population. So again, macular degeneration refers to degeneration in the retina, in the very, very central part of the retina, which is what we call the macula. And as you can see on the diagram here, in relation to the rest of the eye, it's a very small portion of the eye, but obviously very important because that's where all of the central vision is located. And so a very sensitive and delicate area, which is important for day-to-day visual function. So what effect does that have? Again, this can cause some distortion and blurriness in the very central vision. Generally, the peripheral vision is not affected. It's mostly the central vision that's affected. And as many people ask, is there a cure for macular degeneration? Unfortunately, there is no absolute cure for macular degeneration, but as you've seen, we have some treatments that exist for particular stages of macular degeneration. And particularly what we discussed with our patient, and the treatment that you saw was treatment for wet macular degeneration. The good news is that also that this is a very, very active area of research, and there are many clinical trials and companies that are devoted to trying to find newer and better treatments for macular degeneration. Now, the goal for the most part still focuses on treatments and possibly prevention of progression of the disease. However, curing the disease altogether is something that is very hard to achieve and may be far off in the future, if at all, because it is a degenerative process of the human body that is very, number one, difficult to understand, and number two, even if we have some understanding of it, hard to cure entirely. So most of the research really focuses on treating the existing problems or preventing progression of the existing problems. Just a brief history on macular degeneration. This disease has been around for many years, and the first reported associations between the macular degeneration causing some effect on the vision in the retina was probably in the mid-1800s. Different treatments for macular degeneration actually started in the 1980s, and the treatment has gone through several different phases and iterations of what has been applied in terms of treatment for macular degeneration. And the first thing we tried in the 80s was a laser treatment, and the idea with the laser was to actually create a burn or scar in the area where the blood vessels were actually bleeding or leaking fluid into the retina. And this generally was effective in stopping that, but however, the laser was actually very destructive to the retina and left a scar behind. And so oftentimes this would be also something that would have an impact on the vision. So not a great treatment, but something that was tried and was used for many years as we had nothing else at the time. And then came a treatment called Visudine photodynamic therapy, which is also sometimes referred to as cold laser. And the concept here is to actually use a photosensitizing dye, which is injected through intravenous means, and then a type of laser, which is not a thermal or burning type of laser, it's a cold laser, activates that dye as it runs through the circulation to stop the blood vessels from leaking, and basically tries to shut them down from the inside. So that treatment came about and was also used for many years, and was a little more effective in terms of stopping this, however, not a perfect treatment. Then we come to the current treatments, and so what is it that we recommend nowadays if you're diagnosed with macular degeneration? And of course, that all begins with starting with from a general systemic standpoint with a healthy diet. So we have a lot of consumer influences in terms of all the fast foods and things that generally are not healthy for our normal diets, and so eating a diet that's rich in green leafy vegetables, fruits, and things that are rich in healthy nutrients is what's recommended, and that's not only good for us on a whole, but also for the eyes and for particularly for macular degeneration. Exercise also recommended, but we always find some type of excuse not to do what we know is good for us. But maintaining an active lifestyle where we exercise, etc., is also found to be beneficial in terms of overall health and wellness for not only the human body but for the eyes also. Avoiding cigarette smoke is very important. This is a known cause of progression or deterioration of the macular degeneration that can be modified. So avoiding cigarette smoke altogether is very important. And protecting the eyes from UV light is also considered important. So just look for sunglasses that block 99% of the UVA and UVB light, and it should say that on the label. So that's also recommended when you're outside in the sunlight. For dry macular degeneration, currently there is no therapy that exists which stops or reverses the progression of dry macular degeneration. So our current recommendations are based upon a study which found that vitamin therapy, so a specific set of vitamins, can actually help to slow the progression or reduce the risk of progression, as you heard about in the dry macular degeneration. And this is only generally recommended if you actually are diagnosed with macular degeneration and have intermediate in one eye or advanced, or at least in one eye and advanced in one eye. And so a lot of folks ask if they should be taking vitamins, at an early stage if they don't have macular degeneration to prevent getting it. There's no science that says that. There's also folks who ask if my family has macular degeneration, but I don't, should I be taking it? And the answer is there's no science that says you should or that it has a benefit. However, a lot of people do anyways because they think that there could be a potential benefit, and it's hard to say one way or the other just because we don't have the data to support it. But it's from a medical standpoint, based on the research, it's only recommended if you actually have macular degeneration. Other than that, for dry macular degeneration, there is no other treatment at this time. For some types of dry macular degeneration, which are considered more advanced forms, we do usually recommend a low vision evaluation, which includes evaluations for certain types of magnifiers or aids that can help assist in maximizing the vision that is there, even if it is somewhat compromised by progression of the macular degeneration. There is a FDA-approved implantable lens, which in very specific particular situations can be used in dry macular degeneration for very advanced cases. And this is a surgically placed device in place of traditional cataract surgery. This is a place where the lens implant in the eye would go during cataract surgery. And the concept here is that this little implantable telescope magnifies an image so it is projected onto a larger surface area of the retina, so you can train your eye and brain to use other parts of the retina that are not damaged by the macular degeneration, even though they're not as sensitive and as detailed as the macula, central macula itself. You can potentially take advantage of some of the other areas of the retina which are not damaged by the macular degeneration. So then we'll switch over to wet macular degeneration. And the current therapy, as you've seen, the mainstay of treatment for wet macular degeneration is what we call intravitreal injections. And this is the standard of care and first-line therapy for treatment of wet macular degeneration. This is a very commonly performed procedure, the most commonly performed procedure in all of Medicare, in fact. And so we do lots of injections nowadays, not only for macular degeneration, but for other conditions too. On any given day, in my clinics, I may do anywhere from 20 to 40 injections in a single day. So this is, again, a very common procedure, just with the number of people that have this disease process. We have several FDA-approved medications that are used for treatment of wet macular degeneration. And over the years, we've had several additions come about The first one was Macular, which unfortunately wasn't quite as effective, and so is not used as much. The next two are quite frequently and commonly used, Lucentis and Ioria. The third is the newest addition, which is called Wavy, and that one, due to some post-approval safety issues, has not taken off quite as much as we had expected it would initially in terms of its use. It is a very effective medication. However, just due to potential safety issues, that one has not been used quite as much. There's another medication which is called Adaston, and this one is not technically FDA approved for treatment of macular degeneration or used for injection in the eye. However, it is widely done so, and it's considered acceptable by Medicare standards. And the reason for this is that it's actually designed originally for cancer treatment, and so it comes in large doses for systemic cancer treatment. However, we take small amounts of it and inject it into the eye just as we do the other medications. And so this is also a very effective medication. So that's sort of where things stand today. And as I mentioned, since this is a very active area of research, there is a lot of potential future developments. And let's take a look and see what some of the things in the pipelines are. And so there are, for dry AMD, some things that are needed, as I said, since we don't have any active treatment for dry macular degeneration. We'd like to see if there's any type of treatment that could potentially slow the progression of dry macular degeneration. And so there are several companies that have some products that are in clinical trials, including one from this company called Apellis that has some very promising clinical results, and we expect that the later stage clinical trial results will be released later this year, and hopefully if we have positive data, then this will be submitted to the FDA for potential approval, and this may be the first treatment that we have for stopping the progression of dry macular degeneration. So that's a promising agent. There are a few other companies that have agents and different technologies for potentially slowing down dry macular degeneration, including treatments that are derived based on stem cells, such as this company's treatment from a company called Photodynamic, in which cells are actually injected underneath the retina that are derived from stem cells. And similarly, there are several other companies that are pursuing in some somewhat earlier stages different types of treatments for dry macular degeneration, and some of them have early promising results, but have to go through many more phases of testing and clinical trials before we know if they're effective enough to be approved by the FDA. A few different companies that have molecules that they're studying for this. There is another approach or technology which is called the RPT, or regenerative patch technology, and this is a slightly different treatment in which human embryonic stem cells are actually placed on a single layer patch, and then that patch is surgically implanted or inserted underneath the retina in the area of the deficient retina affected by the macular degeneration. And you can see the size of this little patch. It's a very small monolayer of cells that sit on this patch that's then placed actually through a surgical procedure underneath the retina to help replace unhealthy cells. So this is in very, very early stage phases for testing, and may, after some further testing, progress through the channels and be a future treatment that we have. So that's something else to look out for. For wet AMD, well, we already have treatment that actually works very well and very effectively. And so what is it that we need now? Well, we need other treatments that maybe work better or last longer or are potentially easier to deliver. As you know, and as you heard from our patient, you have to, if you're having to come in regularly to get injections, that's quite a burden. And most people don't mind if it means that they get to preserve their vision and get to keep seeing, but it is, obviously a burden, and there are some psychological aspects to it in terms of the fear and hesitation of having to get a needle injection into the eye itself. But So, if there's any other easier ways to deliver rather than having to get injections on a monthly basis, then certainly that would be favorable to our patients. Just to highlight a few things that we think are going to be promising in the near future, there's a molecule called Perisima, which has been actually been submitted to the FDA just recently for for approval. And this is basically a newer type of molecule that actually consists of two different component molecules, and having those two different molecules, which work slightly differently, work on different parts of the pathway in macular degeneration, may prove to have additional benefits in terms of how long the treatment lasts. So they're looking at seeing if if some of these treatments actually can last for 4 months instead of having to do every month, every other month treatment. So that is something we may see in the very near future. Another company has a similar dual molecule, but it's in the earlier stage of development. So as I mentioned, quite a few different companies have agents that they're looking at, including this company that has a completely novel drug that's a brand new mechanism for targeting macular degeneration, and this has some very promising initial results also. There's also another company that has a promising molecule that could have a potential increased durability of over 3 months. That's in phase 2 clinical trials at this time. And then this is a very exciting and rather interesting technology that could have huge potential applications and consequences for improved treatment for macular degeneration in the near future. And this is a type of gene therapy by a company called Bio, and the concept here is that you actually, through a surgical procedure, deliver a vector of cells into the underneath the retina, in fact, and those cells that are injected underneath the retina then actually produce the medication from within the eye. So rather than having to actually deliver the medication by injecting it on a regular basis, you actually put the machinery or the factory into the eye to actually produce the medication and the drug from within the eye. And then it does so on a continuous level, and you have constant level of drug treatment, which, as we know from many other conditions, it's usually better to have a sort of consistent, even medication administration than having these big boluses where you get a large amount of medication and it kind of fades away, and then you add more medication and it fades away, which is what happens when we give you injections. And so having this sustained delivery through production of the molecule from within the retina itself is actually a very interesting and a very exciting concept. And we're actually just starting the clinical trials for this particular type of treatments. So we're very excited about that. Another company has some similar type of gene therapy, which has earlier stage positive results. And then I'm going to talk about another very interesting and exciting concept in treatments. And this is even more exciting because this is, and I'll get to this in a moment, a surgical type of treatment with an implanted drug delivery device. And basically the concept here, this is called a foot delivery system. And this comes from the company Genentech, which is the same company that has the molecule Lucentis. It's already approved, but basically they have an implant that is placed in the eye, in the wall of the eye, through a surgical procedure. And this acts as a reservoir for medication that is then continually delivered into the eye, as I just mentioned, which is generally thought to be a better, more effective concept by having continuous delivery. And so this implant is surgically placed in the wall of the eye and delivers the medication. And once that medication, if it does run out and the effect wears off, that can be refilled by injecting more medication into the implanted device just in the office. And this could potentially last for 6 months or a year, so in some cases. So, and this is what it looks like when it's placed in the eye. And you can see it sort of sits under the skin of the eye. And when you're looking at a person who has this, you can't tell that they have it unless you have them look down and look at their eyelid. And the patient themselves, if they have this, can't tell that there's anything in their eye. They don't see anything or feel anything. So it's a very discreet device, and again, it needs to be refilled, can be done just with a needle in the office, similar to how we give our injections currently. But the concept here is that that wouldn't need to be done very frequently if it lasts, even 6 months or a year potentially. So the exciting part of this is that this was just recently approved by the FDA. And so this is the first surgical treatment for wet macular degeneration that exists. And this is about 10 days ago, the Friday before last, this was approved by the FDA. And so this will slowly be entered into the market for potential recommendation to any patient. Our group here, we've done a number of these procedures as part of the clinical trials and seen the benefit that it can have, but it will be available very shortly on a broader scale because it's been approved by the FDA. So that's the exciting piece of news regarding that type of surgical treatment. And so that's kind of a feature of what treatment for macular degeneration looks like. And so at the end of my slides, and I'm happy to take any questions at this time. So I'm going to start here. After an eye injection in about half an hour, I feel like there is an eyelash in my eye. The feeling remains until I go to bed. It's gone in the morning. I cannot read well the rest of the day either. So that's a very common scenario after getting an injection. I don't see a question in there, but that's a very common comment on a very common sensation to have after getting an injection. And that generally does resolve, by the next morning. And that's just a little irritation on the surface, and sometimes there's a little blurry vision just because you have had a fluid injection into the eye. Next question is, how many injections do you need? Well, that is dependent on the individual patient. Some people need to have ongoing treatment for many years and even potentially indefinitely to keep the macular degeneration under control. But initially we treat about once a month, and then depending on response, after say 3 or 4 injections, we decide what the next step would be in terms of, can you go longer between treatments? Do you need to continue treatment? So it's all individual, but most people in their first year of having the diagnosis of wet macular degeneration end up having about 7 to 8 injections in the first year. So, will there be an injectable that you will only need one? So I covered some of that in my talk in terms of what was in the pipeline. So we are hopeful that there are things that can be done that can limit the number of injections that folks get in the future. I always end up with my lids turning red and getting swollen. Why is this? Sometimes in the process of preparation for the eye and the eyelids can get a little irritated from either the numbing agents, the anesthetics, or the antiseptics that are used to sterilize the eye. And so it may just be a reaction to one of those agents. Our next question, I heard that drusen is the same as cholesterol. So if you're taking cholesterol medication, will this not stop it from forming in the eyes? That's not entirely true. Drusen are deposits that develop underneath the retina. Technically, we don't think that they're actually composed of cholesterol, and taking cholesterol medication does not stop that from developing in the eye. So that's not related. Next question, my mom has wet macular degeneration. What are my chances of getting it? That's hard to say. It's a very complex combination of things that can potentially put you at risk for developing macular degeneration. And again, the number one risk factor is age. Having a family history is a big risk factor also. So the chances of getting macular degeneration are higher than normal. And then of getting wet macular degeneration, it's not of actually getting wet macular degeneration just because your mom has it doesn't mean that you're going to get it or put you at higher risk of it, but just overall you have a higher risk of getting macular degeneration in general. But whether it turns wet or not, there's no correlation between your family history. Are there tests out there that will diagnose macular sooner? So There are ways of trying to detect macular degeneration at an earlier stage, and some of that includes evaluating the function of the retina and the macula in terms of light and contrast sensitivity and colors, etc. So there are ways of trying to detect it earlier, but there's not a definitive test that says, yes, you have early macular degeneration before we can actually see physical signs, excuse me, physical signs of it in the eye. At this point, the diagnosis is still made based on clinical findings, including what we see on our examination and our imaging testing that we do in the office. Next question. My vision stays blurry for a couple of days after the injection. Is this normal? For some people it is, yes. Sometimes the vision can stay a little blurry for a few days after an injection. So it's individual, but it's not uncommon to have a little bit of blurry vision for a day or two after an injection. Next question. Why does it seem that research is focusing on wet macular more than dry? It certainly seems that way, and part of the reason is that we actually have more science or knowledge of what causes or what the underlying problem is with wet macular degeneration. We already have treatment that's approved, so and effective. So people kind of focus. Some of the companies and research actually focuses on things that already have sort of the ball rolling, or the train is already on its way. So they kind of jump on that same train. That being said, there is still a lot of research on the dry form. It's just that since we don't have anything approved or known to be effective as of yet, it seems like there's less focus on it, but there is still quite a bit of focus on the dry because there's potentially a greater need on that side. Since we do have an effective treatment for the wet, then the need is potentially greater on the side of the dry. So we just don't hear as much about it because, again, there's not an accepted or approved treatment at this time. If there was a treatment for dry macular, would this stop wet macular degeneration? We don't know that yet because it may be that those two concepts or components may act somewhat independently. So until we have a treatment and we run it through clinical trials and have the number of patients who have gone through it and have more data, we really don't know the answer to that. And then question about lumotherapy therapy. Has it been approved by the FDA? And so lumotherapy therapy, I'm not too familiar with that type of treatment, and I don't believe that there has been any FDA approval for such therapy. So at this point, it's not something that's commonly used or accepted for macular degeneration treatment. Okay, I have an extremely strong family history. Mother, her 2 brothers and sisters, 1 uncle is almost completely blind. Are there any studies for my children? So technically, other than getting a baseline examination, there aren't any definitive studies to say, yes, children are gonna get it or not get it. But it's a good idea to at least get a baseline examination at some point. Now, obviously, there are some types of genetic tests that are available. Whether or not they give you a 100% accuracy in terms of your risk for developing macular degeneration, it might be an indicator of possible risk, but it's not going to tell you definitively yes or no. So there's no test that's 100% that will say yes, you will get it, no, you won't get it. But it's a good idea just to keep up with getting regular exams, especially with a strong family history, to make sure that if anything is showing up, it's detected at an early stage, and then proper recommendations can then be made based on what's found. Okay, question is, should eye doctors give a patient diagnosed with dry macular degeneration a grid to check for wavy lines? I had never heard about the grid until I got wet and learned about it elsewhere. Generally, yes, when someone is diagnosed with macular degeneration, we recommend self-monitoring at home, and that can be done with something called an Amsler grid, and that's just basically a grid on a sheet of paper where you can look for any disturbances or changes in the lines to see if they become crooked or wavy. So that is generally commonly recommended for anyone who's given them a diagnosis of macular degeneration, no matter what stage. Next question, is there a way to know if you have the beginning of dry AMD other than a surprise diagnosis at your annual eye appointment? Does dry always lead to wet? So again, at this point, the best way for a diagnosis is based on clinical examination and diagnostic testing that's done in the office to look at the retina in more detail. Outside of that, there's no way of knowing beforehand. And does dry always lead to wet? No, dry is definitely the more common form, and only about 10% of dry macular degeneration turns into wet macular degeneration. So it's not that it's inevitable or destined to be that dry turns into wet, but it is a risk that is obviously a concern, but it's about a 10% risk.
Thank you very much. And thank all our guests. It was a great presentation, and enjoy your evening